जय झूलेलाल ऐं सभिनी खे नमस्ते हरिओम। सिंधी हेरिटेज फाउंडेशन एंड दादूजान हांगकांग प्रेजेंट्स संस्कार। संस्कार जे अॼु जे एपिसोड में वी आर डिस्कसिंग अबाउट हार्ट प्रॉब्लम। असांजा अॼु जा गेस्ट ऑफ ऑनर आहिनि डॉक्टर प्रशांत शाह इज़ नंबर 1 सर्जन फ्रॉम हार्ट सर्जन फ्रॉम चेन्नई ऐं असां सां गॾु हुन सां गॾु क्वेश्चन एंड आंसर कंदा अनीता मामरी एंड श्री सीजे ठाकुर फ्रॉम बैंकॉक। ऐं हर दफ़े जे वांगुरु असांजे विच में श्री दयाल हरजाणी पंहिंजे मन की बात कंदा। त अॼु जो ही प्रोग्राम असां शुरू कयूं हुन खां अॻु सभिनीनि खे एडवांस में असां चेटी चंड जूं लख लख वाधायूं ॾियूं था। नेक्स्ट सैटरडे 2 ऐं 3 अप्रैल सॼे विश्व में सिंधियुनि जो नओं साल सिंधी हिंदू न्यू ईयर चेटीचंड उमंग उत्साह सां मल्हायो वेंदो। त हुन जूं असां एडवांस में सभिनीनि खे करोड़ करोड़ वाधायूं ॾियूं था। ऐं हिन दफ़े 2 सालनि खां पोइ असां मौज कंदासीं, मस्ती कंदासीं ऐं पंहिंजे झूलण खे पब्लिक सां गॾु पब्लिक प्रोग्राम्स में यादि कंदासीं। त अचो जय झूलेलाल सां गॾु असां ही प्रोग्राम शुरू था कयूं। ऐं मां इन्विटेशन ॾींदुसि श्री दयाल हरजाणी साहब खे कि हू पंहिंजे मन की 2 अखर ॻाल्हाईंदा ऐं सभिनी खे वेलकम कंदा। श्री
जय झूलेलाल, Sataram, Sataram Sakhi, and Hari Om to all the viewers all over the world. Today's topic, as we have announced, is a very interesting topic for all of us, that is problems of the heart. And to dispel our doubts, we have our guest of honor, Dr. Prashant Shah, surgeon. He's a cardiac surgeon and a gold medalist, director and chief consultant pediatric cardiac surgeon. So he works in Chennai for Namar Heart Hospital. He has got a 15 years experience in pediatric cardiac surgery. And he has worked with legends of cardiac surgery. And he has visited Mayo Clinic, Rochester, USA, Cleveland Clinic, Ohio, and USA. He has performed more than 6,000 pediatric cardiac surgeries, which includes a variety of complex congenital cardiac surgeries and redo surgeries. He has operated patients from 9 countries, and he has operated more than 1,000 patients in Iraq, where he is regularly going now. He's been invited by the government of Iraq to come and help perform the different kind of neonatal cardiac surgery and valve repair surgeries. So without further ado, I will invite Mr. Mr. Surgeon Dr. Prashant Shah. Please, welcome.
Can you hear me? I'm not
Prashant,
able to hear you, please.
can you hear me? Can you give a bigger screen to Dr.
Hello.
Prashant? Can you give a bigger screen? Dr. Prashant, Pradeep ji छा थियो वरी?
डॉक्टर प्रशांत जो
Prashant ji, can you hear me? Can you hear me, Prashant ji? Hello. छा थियो नारायण? छा थियो नारायण?
I think there is network issue with Dr. Prashant. त मां हुन सां ॻाल्हायां थो ॾिसी मां रिक्वेस्ट कंदुसि प्रदीप खे
किए तो थे ये सब.
No,
Network
this is
issue है
working
दादा.
well.
Yes, yes. Now okay.
प्रशांत
Are
जी,
you
can
hearing,
you
sir?
hear? आप सुन सकते हैं मेरी आवाज? वेरी क्लियरली. अच्छा यार.
हाँ. प्रदीप जी नंबर तो मोकलिया मुझे. हेलो. प्रदीप जी,
You want to?
जैसे मां रिक्वेस्ट कंदा सर कि ऐसा
जी
मां ॻाल्हाइनि थो
जी
जैसे तव्हां उहो हिकिड़ो
अची विया कनेक्ट थी
Yes.
विया
Sorry,
प्रशांत
there was
सर.
a, yeah, sorry, I can, there was some technical hitch. Thank you, Dayalji, for giving the introduction. And please repeat your question so I can start now because there was, I cannot hear you the last point what you told. Sorry for
Okay.
that.
Now, traditionally, we like to welcome all our guests of honors with a Kabir Doha. So I will, cite a Kabir Sahib's Doha for you as a welcoming gesture. Is that okay?
Yes,
Sahib Kabir says, "तैसे ध्यान धारा हो, तैसे ध्यान धरा हो जिन, बहुरी ना धरना, बहुरी ना धरना, ऐसे ही मरा हूँ की बहुरी न मरना." Now, this is not so easy to understand for everyone, so I'll translate it to you for you. It says, the English translation is, learn to meditate as such. Learn to meditate as such, a steady flow without strain. Learn to die a death as such, never to die again. Now, this is a very deep meaning. आप समझ गए ना? So, Sahib is advising us sincerely that we should all endeavor to meditate deeply to a point that we experience our transition or death, that is to know that we are not the physical body, but we are divine souls and therefore divine soul personalities. So while we exist on this earth plane, we must all try to achieve liberation so that we can transcend the cycles of birth and death permanently and rest in everlasting bliss. That is a message of Sahib. And I would like to end it with one poem from my book, Romancing in Your Soul. It says, "Fascinated by the plane's might, yearned to fathom its flight. As I learned all about parts, to remake even if torn apart, yet grounded was I, a tear and a cry, till a man from heavenly skies came by and taught me to soar and fly." Jai Shri Krishna. So now
Jai Shri Krishna.
you're clear on that. And I will now
Yeah.
request Pradeep to invite our panel speakers before we start asking you the questions. So may I have the two panel speakers on the screen so I can introduce them to the viewers. Okay, first and foremost, we have uh, Anita Bhamri, by popular demand. She's a student of yoga and mysticism, and she just got a certificate few days ago. And congratulations to you.
Thank
She
you
is
so
a
much.
very compassionate soul, and her dream is to work in a elderly care home.
Yeah.
And maybe we might be able to fulfill your dream. I invite you to come
Bless
back
you.
to
Yes,
take care
yes,
of the elderly home if God gives us enough strength to operate this in Hong Kong.
absolutely. Yes,
And
yes.
then we have done, not the least, the most famous CJ Thakur from Thailand. He is the president of Thakur Foundation of Vimla Jivan Jhulelal Mandir in Pune. He is a general secretary of India Association of Thailand, past president of Thai Sindhi Association and Lions Club, and above all, he also has got a compassion heart. and he's a social worker, he's a philanthropist, and a proponent of Sindhi Hindu culture. Welcome, both of you, from my bottom of my heart. So,
Thank you very
before I
much.
give you to ask questions, I will ask Doctor a few questions, start the ball rolling, and then CJ Thakur can continue. And after that, you can go ahead, Anita.
Thank you.
अच्छा डॉक्टर जी, आप pediatric cardiac surgery में specialist है. Can you tell us what is the difference between pediatric surgery and regular adult surgery? Can you throw light on this? What are the main different features of these?
Yeah, thank you, Dayalji. Thank you for inviting me for this STEAM Sanskar channel. And before I start my answer, I'll just congratulate for your book, Kabir Ke Do Hai, which I have one copy which you gifted. I've read about it. And second copy I'm waiting from your side. So the question about this, what is the difference between congenital heart surgery and adult heart surgery? So first of all, the pediatric heart surgery per se is called congenital heart surgery because it is all birth defects. All children who born with the heart defects, and if we perform surgery for this birth defect, it's called either congenital surgery or pediatric cardiac surgery. So there are sets of problem in the heart, like a hole in the heart, or there is a different connections are there, or there is abnormal connections of the artery or veins, which falls into the category of congenital heart defects, or these are the patients are pediatric group of patients, and these surgery are called pediatric heart surgeries. When we talk
Nice.
about the adult heart surgeries mainly the lifestyle related problems and some of the infection related problems. When I'm talking about lifestyle related problems, is like a stress, food, and which I will talk further into the different topic next part. Like coronary artery disease, we can commonly term as heart attacks. So these are the problems normally happen into the adult patients. Now we can see even younger patients are getting the heart attack. So these are the acquired defect, acquired because of the lifestyle, acquired because of the habits, bad habits, acquired because of infections. So whichever is acquired heart problems are seen, and surgery for this acquired problem is called adult surgery. So there is a gross difference between pediatric cardiac surgery and adult cardiac surgery. So, so I can summarize: adult means acquired heart problems, surgery for that, and pediatric means birth defect. They born with heart problems, and we perform surgery for this. So this is the
So
main
now
defect.
the question comes that what is the status in India of these birth defect surgery, patients, pediatric congenital cases? Do you have any statistical data on that?
Yeah, see the congenital heart defects. I'm not only talking about in India because I operate in so many countries. I travel regularly to Middle East as well as in Africa, and I have been into the different part of the UK, US, and all. So statistically, if we can see India or other part, the incidence of congenital heart defect means birth defect is 9 children born means 1,000 children born. There is a 9 children born with the birth defect. So nearly 1% of children has a birth defect, which is a really a big number. And the same incidence happens into the India. We have a lot of literature. Incidence has been published by All India Institute of Medical Science from Delhi, and different part of the country. We have average incidence of 1% of the live birth. So this is the incidence in India.
I see. So, how do the parents come to know that their child has got a heart problem? Is there any way to avoid
Yes.
or
So basically, there are two category of the defects, which is the first category I'm talking about is very severe defects where there is a completely abnormal connections of the body artery and the lung artery, and these kind of babies they born with a very low oxygen level, and on first day or second day itself, you can see the color of the baby is very blue, oxygen level is very low, and on the delivery time itself, the neonatologist will inform the parents that your baby has some congenital heart defects. And there are babies where has a simple hole in a different part of the chamber. These are the patients, they have a more blood into the lung artery. So they will have a recurrent cough, cold. They will not gain weight. The feeding will be very, very low. During the feeding, there will be sweating on the forehead. And these are the signs. Parent will come and tell that my child is not eating well. He is getting tired very early, and he's very poor eater. So these are the symptoms is there, then we will auscultate the baby and do the echo and we find out the problem. There is third category of the patients which has a low oxygen level, low blood going into the lung artery. I'm trying to use more terminology which is mainly for the
Yes.
common
Thank you.
people use it.
Yeah.
So if the blood goes little less in the lung artery is basically artery which first take the impure blood and then it carries to the lung make it pure, and then it goes to circulate into the whole of the body by the left side of the heart chamber. So when the lung arteries are narrowed and there is a hole in the heart, this defect is called tetralogy of Fallot, which is very common, and these babies are blue babies. Even they, you can see their tongue, their nails, you can see gross difference. Their colors are blue. So the parents, they themselves find out that these colors are not pink. If you see our nails and tongue, it is a pink, but for them it is a blue. So these are the three different varieties of group of patients. They come across to us and and then we will evaluate with the echocardiogram or echocardiology, and then we will find out which defects are there and we will guide accordingly.
So then in that case, after the treatment of the child, what is their life span or success rate, or can you dwell on that subject?
So as I told you, these are the very, very long spectrum of the birth defect. There are very simple defect, which is like a hole in the heart, we just close and child become completely normal. When I'm talking about completely normal means they live like any normal child. They can even take the spot as their carrier. And there is a spectrum of the defect where normally we have a two pumping chamber, right side pumping chamber and left side. So when we say one heart, actually one heart has a two heart, right heart and left heart. But there are babies which has only one heart. They don't have a two pump. They have only one pump. And we do the three complex surgeries and make a circulation normal, but you cannot make one heart into the two heart. So these baby live a good life, but not a normal life. They live up to 40 years, 50 years. They can go for a pregnancy and everything, but they cannot take sport as their carrier. They have some exercise limitations. So if I can categorize the surgery, 90% of patients, if we operate at the right age, they become normal and they can live the normal life. But there are 5% of group, like single ventricle group, which has only one pump. If we operate, we make their circulation normal, but they cannot lead to normal life. Only the 0.1% we cannot do anything, like a left heart syndrome, where you operate and their lifespan is hardly 5 years or 10 years. But I think 99% of children after the surgery, they lead a good life.
That's very good. That's quite comforting. Now I'll invite Thakurji to question you on few aspects that he has. Thakurji, Hariom.
Thank you, Dayalji. You wonderful session you have done this one, and Dr. Prashant is here. He has given very valuable knowledge on this one, which especially me, I didn't knew. Although I'm a heart patient too, I have done bypass. I don't knew of this thing. So this is something new to me also. And what viewers are listening and taking this one, this is really helpful. Okay, now what are cases of birth defects in children? How do you prevent this one?
Causes.
Causes, yeah.
Yeah. So if we talk about the causes, only the 20% of congenital heart defects we have really found out the cause. Like there is a certain genetic defects which runs into the families, uh, and there are certain uh, diseases which is happen during the pregnancy that can lead to a congenital heart defect. But 80% of the congenital heart defects we are exactly when I'm talking about we as a whole community of the world. So we really don't know the 80% of the defect why it happens. But one thing common, that which are the high risk group. So I should highlight the main high risk group is like uh, elderly parents. If there is a marriage inside the families, like if there is very close family, there are certain region of the India as well as some of the community, they do marriage in the family, and we can see a lot of congenital problem more common into that kind of that. Then, if the mother is a smoker or alcoholic or diabetic, then the congenital defects are we are seeing very frequently. And as I told you, that late marriage, infertility, these all carries the high risk of the congenital heart defects. So these are the main issues which I would highlight that. But otherwise, 80% defect we don't know. I always explain to the parents that what food we eat, what milk or water we drink, we don't know what pesticides we eat in day-to-day life, and that causes the congenital heart defects as well as there are a lot of cancer. If you see, cancer are also increasing. Even today's technology, we are not able to control the congenital heart defects. Even in US or UK, the incidence is the same like in India. So these are the real fact actually.
Can I interrupt here? So, moral of the story is jaldi shadi karo, aisa?
No, I always tell that see, no,
Jaldi
now
shadi
we are,
bhi karo, aisa?
yeah, actually we are focusing more into the career and all, but we are not focusing in the life per se. I'm just
Yes.
going for the means spirituality. But if we start learning from our ancestor, the way they their 26 year or 27 year, their family life is completed. They will have two children, and practically also they can enjoy each stage of their life. They will enjoy their when they are grandfather, they are really at a good age, they are grandfather at 50 years, they can enjoy their grandfatherhood also. But now the groups are like they wait for a long time. And
Jay,
yeah,
okay.
next question please.
Now, heart diseases are even very common in adults. What is the difference
Yeah.
between problem in children and adults' heart disease?
Yeah. So the now before I go for adult problems, as I told you, congenital heart is a birth defect. There is a different part of the heart tissues are not available and make a hole and all. But in adult, before I just want to explain what is the heart per se. Heart has a surface of the heart has a coronary. I'm using the coronary artery, which is commonly used nowadays because a lot of cardiologists explain about coronary. Coronary artery is nothing but it's a blood vessels which supply pure blood to the heart muscles. So that is called coronary arteries. And inside the heart there is a four valves. So there are two main valves. It's a mitral valve and tricuspid valve. And other two valves are the great artery valves, aortic valve, and pulmonary valves. So the problem of the coronary artery disease means vessels of this heart, or there is a problem of these valves are mainly seen in adult heart surgeries. And along with this, there is a body artery which comes out of the heart, which carries the blood to the body. It's called aorta. In common term, it's called it's like aorta is very commonly used, which carries the pure blood to the body artery. So if there is a dilatation of these great arteries, then that is called aneurysm of the great arteries. So these are the most common problems seen in adult coronary artery disease,
Yeah.
valvular heart disease, and the aortic heart disease, aneurysm and all. So these are the main problems. As I previously explained about the congenital, I don't want to go again because whatever hole in the heart or different connections or stenosis of the part of the either arteries or veins or different chambers, then that is consistent to be the pediatric heart problems.
Gigi, okay, what are the common causes of coronary artery disease in common? We have a heart attack.
Yes. So we use the, in layman term, we always use the term heart attack. So
Ji.
first I'll answer that what is this heart attack? Heart attack is nothing but the part of the muscle of the heart doesn't get the proper blood supply because
Uh,
of the blockage of the coronary artery disease, which brings the blood to that part of the muscle. So if it stops immediately, then that part of the heart starts crying. So that
mhm.
cry of the heart we feel as a pain in the chest. Okay, so
Okay.
it's called ischemia in our medical term, but in layman term we always say that is a part of the heart is not carrying, so it is a crying of the heart. So what is the commonest problem of this coronary artery disease? So the first problem I always see is a stress in the form of mental stress or physical stress. Second is a diabetic, third is a smoking, fourth is a hypertension. And fifth one is a bad lifestyle, sedentary lifestyle. When people doesn't walk, they work only on the computer. They eat more fast food and all. Here I want to uh, put more stress on the stress because uh, everybody knows that diabetes, if it is there, then risk of the heart problem doubles down. If you are smoking, the smoking triples the heart problems three times. If normal person has a heart problem, certain percentage, if you are smoker, your percentage of the heart problem is three times. The same like hypertension, it is a two times. But when I'm talking about stress, not here I want to highlight about the sleep. There is a new study has come that if you don't sleep for 7 hours a day, your stress level of your body is increasing very high, and it gives the similar effect of the smoking. So you imagine what is the relation of the stress to your heart problem. So different social stress or your business stress, this is a different, but the commonest is a sleep, because nowadays I have seen a lot of sleep disorders, and here I want to tell each and every viewer that don't think that you have a stress only outside. You have a lot of stress inside yourself. So start relaxing yourself and take adequate sleep. When I'm talking adequate sleep, don't think that 2 hours now, after that to make up 7 hours like this. You should sleep 6 to 7 hours sound sleep at a stretch. So that is what I want to tell everybody. Rest of the
So
thing
that,
everybody knows because Google is a Google Baba tells you everything.
Some people
yes,
sleep more than 7 hours. तो ठीक है. कौन बोलते हैं खाली 6 hours sleep करो.
Yeah,
कोई बोलता
see,
है
when you
7 hours.
age, sorry to interrupt, when you age, your sleep cycles comes down, it becomes 6 hours. I'm talking about 7 hours is the average, like average group, because when you age 50 to 55 years, your sleep cycle come down to 6 hours. That is a different this thing. But your body demands 6 to 7 hours definitely.
तो
okay.
यानी कबीर साहब बोलते हैं कि
Mhm.
चिंतन करो पर चिंता मत करो.
Yes, very good.
हाँ.
हाँ,
Go
जी
ahead, ठाकुर सिंह.
जी जी, अभी वो देखा, अभी पैंडेमिक चल रहा है, तो हार्ट पेशेंट्स को क्या, कहाँ पर, वेयर ही हैज टू टेक केयर इन दिस पैंडेमिक टाइमिंग, इन कोविड टाइमिंग,
Yeah, so basically,
हार्ट पेशेंट्स मोर, और कैन यू हाईलाइट ऑन दैट वन?
yes, yes. So there was a big questions we were discussing on that time that now there is a lockdown. Now everything is open up, but when there was a lockdown, our number of OPD is closed. Where are these patients? They went. Where are these patients and why they are not coming? Is heart disease stopped, or is we are treating too early, or we are misleading the population. That was a common talk happening among the doctors. So your questions is very valid. See, when lockdown opened, we have seen so many patients came down with the end stage disease. See, whenever there is a coronary artery disease, the nature always takes care. If you have a if you are a sedentary life, you are sitting at home, you are not doing any exercise, anything. If you have a heart attack or it's mild heart attack, and if you don't do treatment, you cannot die. But that part of the heart becomes completely dead. So if your muscle, you have 100% muscle, and now your 30% muscles are dead. So your function of the heart becomes half of the thing. So we always measure that as an ejection fraction of the heart. Mr. Thakur, you must be knowing because you are going for multiple echos. So
That's right.
when ejection fractions is normally we see 65% to 70%. We have seen a lot of patients come to our OPD with very low ejection fractions. And when that stage arrives, even the surgery cannot help. So when we are talking about the lockdown, the main problem happened was the unreversible damage to the heart with a lot of patients. And this patient has to live the whole life without surgery and with the same kind of heart function. And they end up into the cardiac failure, and they will end up into the heart transplant. So when we see that less patients has come, it is not that less patient has come. They have got into irreversible damage at home, which we cannot do it because they cannot reach hospital. They're silent attack. I can say there are a lot of silent attack happen, and then the nature has taken care by the collaterals, so small arteries or veins, which happens naturally. Nature always takes care of everybody. So it is not that every heart attack patient dies immediately. There are hardly, I can say, hardly 3 or 4% of patients with a heart problem dies without, like they had a heart attack, they have irreversible arrhythmias at home and they die. But rest of the patients, they can reach to the hospital, they can get treatment, and they can have a surgery or stenting, and that part of the heart will get back the blood supply and they become normal. So this is the gross difference we have seen in the pandemic. I hope I have answered your question.
Yeah. You answered very well. And last question. Now I want to ask this hole in the heart,
Yeah.
which is only for children or elderly people can develop in later stage also at the age of
Yes.
50, 60s.
So when I'm talking about a hole in the heart, normally hole in the heart happens by the birth only. There
Okay.
is a congenital defect. But as I told you that if hole happens in the upper part of the chamber, two chamber called atria, and the hole is little small, it doesn't give the symptoms. So they ignore it and they present at 40 years of age or 45 years of age when their compensatory mechanism is not good as a young or child. And
Mhm.
then they will find out, oh, I have a hole in the heart. It happens now. So we always tell, no, it is a birth defect, but you discover now by the echo at 45. I have seen patients 55 years of age. They come back with the first time diagnosis of atrial septal defect, which we can say ASD, hole in the upper two chamber, which is common. In the lower two chamber, if it is hole is there, they always present early, and no way they can. And there is one more which is very complex. That hole happens because of the coronary artery disease, where uh, the muscle become damaged so much they die off and create a hole. So, but it's an acquired disease, it's not a birth defect, and it's a very I can say difficult to operate and very high risk. But that is happens into the neglected coronary artery diseases where they have not taken treatment, and at stage they come into the emergency.
Okay, thank you very much. And now we have Anita ji waiting. So I think we want to listen to
Yeah,
Yes,
her.
you're next.
all
Thank you.
all my questions
Thank you,
have
Dr.
practically been answered. So, Dr. Shah, I really got to say one thing. listening to the way you've put so many of your answers out, but reading in between the lines, what I'm picking up is that you're really one of those doctors who doesn't just want to cut and chop. I see you emphasize so much on a holistic lifestyle, and that's
Yeah.
so wonderful to hear. So let's just expand on that, because we're reaching out to the larger community on wellness.
Yeah.
And you've touched briefly on so many of these topics again and again about our lifestyle. So yes, we know about smoking and dietary and fast food, but those are really very big and over encompassing. There are other areas too that we could, or we probably neglecting to look at. So could you highlight and tell us probably what? So a lot of us are not smokers, and a lot of us are not, but we still have to look after our heart. How do you suggest we, yeah?
Thank you, Anitaji. I heard that you are a wellness coach and you live a good yogic life. So
Yes, that's right.
I think you can answer this question better than even me, because you are practicing
No,
every
from
day.
the other side.
But as a heart surgeon, I always tells that, see, prevention is always better, because
Yes.
once you come to us, we have to do something. But why you should bring a situation that you have to come to us? To
Yes, I
take
agree.
care of yourself at a right age, because you start getting at 45 or 50 years of age and think that, okay, I'll start doing the yoga and I will not have any heart problem. This is not true. The heart is pumping each and every day from the first day of our life, and we
Yes.
have to take care of our heart at a young age. Then only we can live a good life at the middle and the later age. So
Right.
if you want to have a good life, start these good habits of meditation. I always tell that meditation has a very, very good effect, because uh, if you do a proper technique meditation for at least, they say whatever your age, that many minutes you should do meditation. If you are
Very
30
good.
years, 30 minutes. So
Yes.
if you do that meditation, it gives the effect of 6 to 7 hours of the sleep. So as
Yeah.
I highlighted again, that stress level is the main cause of heart problem, and the meditation uh,
Calms you
helps
down.
a lot in reducing that. Second thing
Yes.
is, to sit for the meditation, you should have a proper posture. And for proper posture, you require a proper yoga to be done properly. Either you, if you don't believe in yoga, please don't go for that. You go to do the stretching exercise. There are a lot of other ways,
Yeah.
but I like Surya Namaskar very much, because it
Oh,
has a
fantastic.
12 steps, and
Yes.
all
That's
steps,
so good.
different posture has a different yogic posture, different phase of the Surya Namaskar. So I always tell, please do it, whatever religion you follow. This
Yeah.
yoga and meditation is fantastic for your heart and your body. The third point I want to highlight here is the food.
Hmm.
See, food, we eat a lot of fast food, and what they put into the fast food to make it tasty, we don't know. We think only about the tasty food, and ultimately you end up into the problem. Second, uh, I'm pure vegetarian, and I always tell all patients, whatever you try to be a vegetarian,
Yes.
because there are a lot of chemicals and injections, steroids and injections are happening into the different level of the meat productions,
Hmm.
and that is the reason we see the different in early anarchy in the children, and early young age people are coming with the heart problems. So
Yes.
these are, so many things are related to the food also. So here I want to highlight about the good habit of the food,
Very good.
exercise, and
Yes.
third thing is, if you cannot do anything, please walk at least 4 kilometers a day, at
Okay.
least
That's very good.
five
So for those who are
five
listening,
yes, and 5 days a week. You take,
right.
if you are not able to walk every 7 days, no problem. 5 days
Yeah.
a week, 4 kilometers a day, make a habit, morning, evening, doesn't matter, but that is good for your heart.
Fantastic. I mean, that really helps. I mean, you were promoting yoga. Thank you. But really, it's. So being the woman on the panel, I'm going to ask some female questions now. So,
Yeah.
from, at least in my case personally, I've had 3 children, and at each stage, I was reminded, take calcium, take calcium, take calcium, and I haven't read enough about it, but I do know that it doesn't get digested into the system, and there is calcification into the arteries. Then, is that actually caused by your physical intake of calcium, or is it being produced in the body?
Yes. So normal body always throw out all unnecessary things out of the body.
Okay.
So first thing is, if our body works normally, then
Yeah.
whatever things you take excess will come out from different part. Okay, so we have a good kidney and liver who takes care of, and intestine who takes care of all unnecessary things into the
Okay.
system. Yeah,
Okay.
so during the pregnancy, all our system works fantastic. Nature takes care of everything. So on that time of pregnancy, they prescribed folic
Yeah.
acid and multivitamin because of the child growth. So
Right.
if you take excess calcium, nothing will happen all the time. And during the old age, like a
Yes.
menopausal age, because you
Yes.
are specifically told about the
Yeah.
female. See,
Yeah.
the females are protected with the heart problem as long as uh, their cycles are normal. And they comes to the menopausal age, their heart problems risk become increased. So, because of the estrogen level, body estrogen level makes a lot of difference in the mechanism.
Right.
So, these are the two things I want to highlight. So, calcium, don't worry about it. Please
Go
take
ahead.
calcium. It is mandatory
Okay.
for female. Yes.
Okay. So please carry on with that, because I'm that menopausal age, and how do we then? So we've got different categories of ages that we are reaching out to, and how do menopausal women, other than exercise, how do you recommend we look after our heart health? We've got, with hormonal imbalances, cortisol obviously is heightened at certain points. Managing stress, as you said, is one way of doing it, getting in good sleep. But what do you recommend for women who are menopausal? How do they look after their heart health? Is there
Yeah. So
supplements?
basically, yeah. Carry on, please.
Would you recommend supplements, or are there
Yeah.
any
So
natural?
no, I don't think there is no magic drug for protecting the heart. Otherwise, there is a lot of pharmaceutical company become
They would call it, yeah.
yes. But again, as and when I'm talking about the high risk means in the normal population, if you
Yeah.
compare, postmenopausals are high risk. So when you
Right.
are in high risk category, you have to be
Yeah.
more careful about your food, more careful about your stress level and the exercise. So
Right.
you should be focusing more about the walking, yoga, and
Right.
meditation at this age than you are a young age. So that is what I suggest. All female, in that matter, in my house, I always tell my mother and my wife, please take care. Walk every day. Whatever you are doing, at least you go down and walk.
Right. So when you talk about walking, we're talking about cardio exercises. So
Yes.
is there? So we're looking at a very brisk walk to, so your heart levels to go up, or is a nice pace? What's the difference between the two?
Yes, there are two kind of. If you are walking on treadmill, you can able to check your heart rate continuously on treadmill,
Yeah. Now
and
that
you
afterwards,
yes, you have a graph also that your target heart rate, and the
yeah,
people start to reach the target heart rate as much as early as, so they start running, we increase the speed and all.
uh,
But for good heart, I always tell a continuous same space, long walking for 45 minutes, at least 4 kilometers to 5 kilometers is good enough. No need to chase any numbers or
oh,
any
that's
heart
so
rate or
encouraging.
anything. Yes.
That's very encouraging. That's very encouraging. Doctor, can you even touch on, now going into your field? operations, and you've got bypasses and stents, and are there pros and cons? Do people actually get to pick, or you as the doctor decide which is the way forward?
Yes. So there is always in dilemma, because all the relatives will phone us and tell that now cardiologists advise that you have to go for the stenting, and some surgeon or some cardiologist say you have to go for the surgery. So what should I do? This is a very common dilemma happens whenever any patient has a heart problem. So basically, both are the stenting is nothing but they puncture your groin and go into the artery. They will pass one wire and go into the coronary artery, and wherever the narrowing is there, they will open the balloon and put the spring like structure called stent. The different varieties of stent is coming now. So that is one method of treating the coronary artery disease. Other method of treating heart disease is wherever the block is there, you just bypass that block and put one alternative blood flow channel from the good to other good part of the heart. Either you take it from inside of the heart or from your leg. So these are the two methods. So first method which I told is done by the cardiologist. It is done in catheterization technique. It's called cardiac cath lab. Second thing is surgery. It is an open heart surgery, or we can say beating heart surgeries. Okay. So now, what to choose? When you have a single artery problem, the stent is the best option.
Okay.
When there is a multiple artery issue, surgery is the best option.
Okay.
That is answer number one. Answer number two is, if you comes in a high category group, like if you are a diabetic and you have more than one artery problem, then you should go with the surgery only, because the chance of instant thrombosis, it means blockage inside the stent, is very, very high. So scientifically, papers and all, our community always says that you should go for the surgery, not for the stent. But now, what happens? People want to avoid surgery and they will ask, no, I don't want to go for surgery. I want to go for stent. Whatever, you want to put 3 stent, 4 stent, you put it. I will pay for it. But I don't want to go surgery. That is where I want to give awareness that it is not a matter of avoiding the surgery. You are actually reducing your quality of the coronary artery disease. And I can say that the next phase of the heart problems will come late for the surgery, but early for the stenting, multiple stenting.
Right. So it's got its lifespan in a way.
Yes.
Okay. Very understood. I mean, Doctor, you've answered so many of our questions, and again, very holistically. Thank you so much for taking this time out, and I'll leave you in Uncle Dayal's hands.
Prashantji, I have in ending 3 questions.
Yeah.
अभी पहले तो एक व्यूअर्स को बताओ कार्डियोलॉजिस्ट और सर्जन में क्या डिफरेंस है, उनका काम क्या है, how you bifurcate these things.
Now I will tell you first I will tell you how much degree we take to do the cardiac surgery. So first, after completion of our 12th standard, we'll first finish our 5 years course in MBBS. After MBBS, we study 3 years into the general surgery, where we learn different part of the surgeries. After that, we learn 3 more years to perform the cardiac surgeries. And after that, we expertise either in congenital surgeries or in adult cardiac surgeries. So if you see in our lifespan, we spend nearly 12 years as a study to become a cardiac surgeon. So our bifurcation happens at the MBBS level, initial stage itself. So after MBBS, if they take general medicine, you've seen general family physician or general medicines. If they further, after general medicine, if they further study about cardiology, then they become a cardiologist. They check the patient, they give the medicines, they can do the angiogram or angioplasty. So there is a wide difference between the cardiac surgeon and cardiologists. Cardiologists are they are diagnostic. They do into the cath lab. They do echo and give medicines. As a cardiac surgeon, we take care of surgery of the heart. So these are a gross big difference.
But if somebody has a heart problem, is it necessary for him to go to a cardiologist first, or he can come to you or a surgeon first?
See, we work as a team. So I always tell that in our team, it's like a cricket team. Every person has a different role. Bowler has to bowl, batsman has to bat, and wicket keeper has to do wicket keeping.
Yeah.
So I can every cricketer can say I'm a cricketer, but their roles are different. So even the patient comes to me directly, I can diagnose, I can give treatment, but the ideal thing is they have to see the cardiologist first, then they diagnose, then we as a team we discuss that which is a good treatment option for the patient, either it is a stenting or it is a surgery. Then in our panel we decide that okay, this patient requires a surgery, let us advise surgery to the patients, and then we'll take for the surgery. Or then we, if it is a for stenting, then we will tell the patient that okay, you are good for the stenting, so please go ahead for the stenting. So it is not that surgeon or cardiologist. This is a one team basically.
So, but even though there's one team, but you will take the cardiologist's diagnostic test as a final, what you call message to conduct surgery, right? His opinion is very important to you.
Yes, yes. Our both of the opinions are very, very important because any person does a single decision, it is always a biased decision because there are a lot of factors takes part like a finance. If patient has to pay to cardiologist, the cardiologist always think that okay, I will do more procedure, I will get more money. The same thing for the surgeon. So we want to remove that bias portion of the decision. So there should be no bias in decision. That's why we should have a team approach. Okay, so to remove that bias, we have to work as a cardiologist and cardiac surgeon has to work together for a benefit of the patient.
So, has it ever happened to you that cardiologist has said, uh, go for surgery, but you have found that it is not necessary, or you have superseded his diagnostic test? Has it ever happened?
Yeah, yeah. See, when we discuss on table, uh, when the patient requires a surgery, and patient has a lot of comorbid state, like patient is severely diabetic, is uncontrolled diabetic, or patient has a very obese and access to the grafts are very, very difficult, or is a very senior person like 80, 85 years is not able to walk, then the risk of the surgery becomes very, very high. And it is not only surgery, we have to send the patient home live and walking. So we always discuss that okay, we can do surgery, but how much risk involved into the surgery. So then we decide, okay, this is a candidate of the surgery, but because of other associated more comorbidities, we should plan for this one or two stenting and send them home. That is safer for the patients. So there are so many times cardiologists tell that okay, go for surgery. Then we surgeons say no, this is not a candidate for surgery. Please go ahead and do stenting and send home.
Very good.
Okay.
CJ Thakur has got a question.
Yeah. Just
Thakur,
just
you have a
out of
question?
box, I just have a question because many people they do ask. See, there's the allopathy, there's a homeopathy, there's a Ayurveda. So when something happens, right? They say Ayurveda is better. They have some good medicines and this thing to avoid all this surgery. This one, even I was gone through Ayurveda, allopathy, what you call a mother's tincture was taken too many times, but still, finally, I end up in a bypass surgery. So there are many people they have this kind of similar what I did through, and what do you highlight on that one? Which is the best one so that people should not go here and there? Ayurveda is also good, which is ancient one. Allopathy is
Yeah.
also good, and homeopathy is also good. But what do you recommend?
Yes. So I always myself, even I'm a doctor, I'm fond of Ayurveda. But
Hmm.
when it comes to the acute disease, I always believe that Ayurveda doesn't have an answer for the acute problems. So whenever there is a chronic problems, whenever you are taking the medicine for the heart, you add up some Ayurvedic medicines. I have no problem at all. If some patient comes and tell I am taking Ayurveda, I'll tell please continue. I don't want to stop anything, and whatever your faith is there, it is continue. But when you diagnose that you have a critical coronary artery disease, and you want to avoid the surgery and you want to do the Ayurvedic treatment and homeopathic treatment, I will tell them that it is not advisable because you will take the Ayurveda medicine. After Ayurveda medicines, your pain, everything has gone. But what happens to the heart? That heart part, as initially I told, that muscle has
Yeah.
lost the critical blood supply. So your heart function become that part become completely non-functional. So after that, you are whatever Ayurveda you are taking, you feeling good, but your heart is not functioning. You will not have pain. So you feel that okay, you have a good feel factor that okay, I don't have any problem. My heart problem is solved. But when you check your echo, you will see that your heart function has come down to 40% or 35%, and you end up into questioning the doctors that why you are not advised on that time. I have seen a lot of WhatsApp messages forwarded to my relatives that somebody was giving some medicine and some chelating agent. Yes, that was very common nowadays. Forwarding that one doctor was infusing some chelating agent, and they are curing that bypass patients become completely cured. They don't require surgery and all. As I told you, that even any patient with a coronary artery disease, if you don't take care, you don't do bypass surgery, nature will take care. Nature has a fantastic phenomena of making a small collateral arteries which supplies the other part of the muscle, but they cannot function normally during exercise, during the stress, during the walking, and then you will start having a problem. So I say that if you have a real cardiac problem, you do your surgery or stenting, but you want to continue Ayurveda, please continue. I don't, I don't say that Ayurveda is bad. Ayurveda is good, but at a chronic stage, not at acute stage.
Anyway, dil ka
Okay.
मामला है.
I
I
have
have, yeah.
one question for you. It's a long shot. Now, I recently wrote a book called Celestial Secrets of Sexuality. So I did a lot of research and spoke to a lot of yogis. And one of the yogis, like Shivananda, Swami Sachidananda, so and Satyananda. Now, according to few of them, excessive expressions of sexuality or pornographic responses cause extra strain on the receptors of the heart. And this is a reason, I believe, as a conclusion, a deduction, that in India there is too many cases of heart attack. I've heard it's becoming the capital of heart attacks in the world. So I believe that there is a too much of sexuality expression in India, possibly because of Bollywood or whatever other reasons, that is causing strain on the heart because of these constant uh, assaults on the libido. Do you have any report on that? Otherwise,
I
I'll
can
have to
answer. I can,
look.
yeah. So I can answer on this part. As I told you earlier, the stress is one of the major factor. Whenever body has a stress, either it is a psychological stress or body stress, our cortisol level, steroid level goes up very high. And whatever sexuality is a one part of the stress. So when if you take the blood sample on that time, the our cortisol level are at peak level on that time. So it is not only that matters. Yes, it is one of the cause maybe which we have not studied upon, but it is not the only cause. I can say that.
That's
The
correct.
last question from my side is the effect of negative emotions on the heart. Because psychologists and research mysticism says that when you have negative emotions like hatred, fear, and dislike, jealousy, envy, these have a direct effect on the heart. Have you come across this kind of conclusion or a statement?
I am 100% agree with this, because whenever you have a fear, you should just put your hand on your pulses. Or
Yes.
wherever you have a anger, you should just put your pulses. So it means that your every action, there is a reaction in your body. So
Hmm.
your emotion or your thought process, that has a direct relation with your heart rate. See, heart rate is a reflection. You can able to measure it, but what is happening at the micro level, we don't know. So, macro level, we are finding out that heart rate has increased. It means there is
Hmm.
a changes in your heart at that particular emotions. You are loving somebody, you have a different emotions. Your heart rate is different. If you are
Hmm.
jealousy, your heart rate is different. You have anger, your heart rate is different. So every emotions, every positive emotions has a positive effect. Every negative emotions has a negative effect. So I 100% agree, and that's where this meditations comes into the play.
But also, attitude also is very important, no, to life. If you
This
have a
all comes in.
humanistic
It's about,
attitude, you will
yes.
automatically have positive emotion. So
It
having
comes as a
positive
bundle.
emotion is the risk of heart diseases. Is a
Yeah.
conclusion.
Yes, 100%. Because yoga is nothing but it's a union between the body and mind.
You're good.
So you have to make sure that your mind and body works at the same pace and the same time. So when you are thinking, the same time your body also should do the same thing what your mind is doing. So 100%. I feel that yogic life will help for your healthy heart.
Thank you, doctor. I think it's
Yes.
time for us to retire now, and show is getting over. Time is getting over, so I'll thank Anita very much, and also
Thank
CJ
you.
Thakur from Thailand, and hope to see you in Bangkok soon. Uh,
Most welcome.
Incidentally, his nickname is Papti. Papti is a very lovable nickname, I would imagine. So he's a very loving heart. Thank
Yeah.
you, CJ Thakur.
Indeed.
And
Indeed.
I will now request today we are trying to say commemorate our Julelal birth
Birthday.
anniversary on the which is coming on second. So I
Yes.
will request Narayan to play the music of as a goodbye to all and also as a commemoration for Julelal. Thank you, Doctor, so much
Teddy
for being
Chanto.
with us.
Thank you for inviting, and have a great day.
And next
Thank
time,
you.
I hope to call
I
your
will.
Ardangani. I understand she's a bariatric surgeon. So the next show we are going to have in May, and we will invite her and ask her how to lose weight, how to take care of our weight problem. I hope
Yeah,
she
she
will.
will talk more about the food, and this is what she
Right.
will highlight about the healthy food habits and
Yeah.
exercise and options for weight loss.
So
Right.
be ready in May for. I'll be inviting her, and then we'll have her on the show. Just convey our
Definitely,
message to her. Okay.
definitely we will. Yeah.
Thank you, doctor. Thank you. Hari Om, all
Thank
of
you,
you.
Thank you, Anindra ji, and thank you, Mr. Thakur.
Doctor.
Thank you, and
Okay,
have a
Narayan,
great day. Bye bye.
go ahead with your music now. Thank
Jai
you.
Jhulelal ji.
Jai
Jai.
Julelal. Jai Julelal.
Naranji, your microphone is off. Mute.
जय झूलेलाल जीअं त नेक्स्ट सैटरडे असांजे झूलण जो 1072 1072 बर्थडे आहे त अचो असां हुन सां धूम मचायूं ऐं हिकु हिन गीत सां गॾु असां अॼु जो पूरो कयूं मां प्रदीप जोधाणी खे रिक्वेस्ट कंदुसि कि हू हिकिड़ो ही सुंदर झूलेलाल जो भॼन हलाए प्रदीप जोधानी।
दतिया जो त शहर सजायो, ओ दतिया जो त शहर सजायो, ओ ॾिसो ज्योतिन जो जलवो, लाल साईं आहे महर वसाई, आयो ज्योतिन जो मेलो। रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। प्रेमी खुशीअ में मगन पया झूमन ऐं नचन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। प्रेमी खुशीअ में मगन पया झूमन ऐं नचन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। रख त ज्योतिन वारे ते पाण ई पूरी कंदो, रख त मुंहिंजे लालण ते पाण ई पूरी कंदो। बहारी गुलन मुखे ॾाढा प्या वणन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। रख त ज्योतिन वारे ते पाण ई पूरी कंदो, रख त मुंहिंजे लालण ते पाण ई पूरी कंदो। लाल झूले सभई चो, लाल झूले सभई चो, लाल झूले। ज्योतिन साहिब जो स्वागत कंदासीं, लाल साईं जा सभु पंजड़ा चवंदासीं, पंजड़ा चवंदासीं, पंजड़ा चवंदासीं। ज्योतिन साहिब जो स्वागत कंदासीं, लाल साईं जा सभु पंजड़ा चवंदासीं। जोइल शहनायूं वॼन, नारा लाल जा गूंजन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। रख त ज्योतिन वारे ते पाण ई पूरी कंदो, रख त मुंहिंजे लालण ते पाण ई पूरी कंदो। दीप प्यासी ॾिसो सुहिणो नज़ारो, पल्ले ते आयो लाल साईं आ प्यारो, साईं आ प्यारो, साईं आ प्यारो। पर दीप प्यासी ॾिस सुहिणो नज़ारो, पल्ले ते आयो लाल साईं आ प्यारो। पयूं खुशियूं थियूं वसन, सभु भाग था वरन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब क्यों अचन। प्रेमी खुशीअ में मगन पया झूमन ऐं नचन, ज्योतियूं साहिब क्यों अचन। सुहिणा रस्ता प्या सजन मुझो ठरे पयो मन, ज्योतियूं साहिब इन खुशीअ में मगन पया झूमन नचन ज्योतियूं साहिब थियूं अचन सुहिणा रस्ता पिया सजन मुंहिंजो ठरे पियो मन
सुहिणा रस्ता पिया सजन मुंहिंजो ठरे पियो मन ज्योति साहिब थियूं अचनि। ऐं अॼु सचीअ में असांजे विच में ठाकुर वंशज बैंकॉक खां सीजे ठाकुर जी असां सां जुड़िया, जेके झूलेलाल जा ठाकुर वंशज आहिनि। त इहा हिकु ख़ुशीअ जी ॻाल्हि आहे। ऐं कल्ह अॼु जो असां प्रोग्राम पूरो कंदासीं साईं लीलाशाह जी हिन नंढी प्रार्थना सां, जंहिंजो कल्ह 142 जनमु ॾींहुं हो। हे भॻवान, असां सभिनीनि खे सुबुधी दे, शक्ति दे, निरोगता दे, पंहिंजो पंहिंजो कर्तव्य पालन करे सदा सुखी रहूं। हे भॻवान, असां सभिनीनि खे सुबुधी दे, शक्ति दे, निरोगता दे करे सदा सुखी रहूं। हिन सां गॾु ई हिकु दफ़ो वरी सभिनीनि खे चेटी चंड जूं करोड़ करोड़ वाधायूं। ऐं हिकु दफ़ो वरी मां थैंक्स ॾींदुसि डॉक्टर प्रशांत शाह खे ऐं असांजे विच में आयल श्री दयाल नरजाणी, श्री सीजे ठाकुर ऐं अनीता बांबड़ीअ खे, कि जेके अॼु आया ऐं हिकिड़ो सुठो क्वेश्चन आंसर जो सेशन हार्ट प्रॉब्लम जे मथां हलायूं। त सॼी संस्कार जी टीम जे तरफ़ां हिकु दफ़ो वरी सभिनीनि खे एडवांस में चेटी चंड जूं करोड़ करोड़ वाधायूं। जय झूलेलाल, जय झूलेलाल, जय झूलेलाल।